Hi, it's Dr. Marcia Sirota here, and I want to talk today about my theme of bipolar 2 disorder. And I was thinking about doing a part 2 because there have been so many celebrities recently coming out and saying that they have bipolar disorder or a bipolar 2 disorder. And I thought it would be important to comment on that because I think, first of all, it's very important that these celebrities are coming out because it takes away some of the stigma of having a major mental illness such as bipolar disorder. But it also speaks to how there are differences in who gets access to care. Obviously, celebrities are going to have more money and more access to the best doctors and hospitals and research institutes, and so they might be more likely to get diagnosed because they have a better quality of care. Whereas ordinary folks, poor folks, racialized folks, all of those people are possibly less likely to get the kind of quality care that celebrities get when they have bipolar disorder. And I wanted to just run through a couple of the difficulties with getting diagnosed when you have bipolar 2 disorder especially. So bipolar 2 disorder is distinguished from bipolar 1 disorder in that bipolar 2 is a much milder version of the disorder, and it's much more subtle and more difficult to identify. Bipolar 1 disorder can be quite dramatic, where people are running in the streets screaming or disrobing or engaging in very disruptive behavior. They could be trashing their home. They could be doing extremely self-destructive things, very out of character. They could be extremely euphoric. They could be hypersexual, picking up multiple partners. And all of these things are quite obvious for their friends and family to see as abnormal and requiring help. With bipolar 2 disorder, however, it can be quite different because, like I said, it's subtle. So the person can have these deep, horrible depressions where they just feel like the world is caving in on them. And then when they have what's called the hypomanic episode, which is the episode of the high in between the lows, they can feel so much better that they see this hypomanic episode as a good thing, not as a bad thing. So even though they might be more energized, talking too fast, not needing a lot of sleep, not having much appetite, feeling on top of the world, feeling a little bit important and special and like they can do almost anything, they can feel invincible, they don't necessarily see this as a bad thing because they're so relieved not to be in this horrible, deep, dark depression that they see the hypomanic episode as a good, happy, positive relief from the doldrums of depression. And so the person themselves is going to have a lot more difficulty identifying the hypomanic episode as abnormal or something that's unhealthy. And the reason it's unhealthy is because the more we cycle through the highs and the lows, the more the brain gets slightly damaged. And so untreated bipolar disorder leads to more mental illness down the road. So we want to catch it earlier and we want to start treating it earlier to prevent more damage into the brain because of these untreated episodes. Now, in terms of the people watching or observing their friend or family member with bipolar 2 disorder, it could be a lot harder, again, to notice that this person is having difficulties. They could just seem more energized, more positive. They could be doing a lot of work, but in this day and age, doing a lot of work and even pulling all-nighters doesn't seem that abnormal. They could be talking really fast and be hyper-motivated to get a lot done, but again, in this day and age, people can be very hyper and super motivated, and it can be seen as a positive. So it's kind of difficult for friends and family members to identify bipolar 2 disorder in their loved ones because these states can seem like normal states or slightly different kinds of states, but not bad things. It takes a trained professional with a lot of experience in this condition to identify the specific kinds of traits and patterns of behavior that identify it as bipolar 2 disorder. They're going to have to really look for what's called pathological state as opposed to just a variation of a normal state. A variation of a normal state is pulling an all-nighter because you have to study for an exam and it's really important. An abnormal state is when you're not sleeping for several nights in a row because you're thinking that you're going to be writing the great Canadian novel, or you're cooking all night, or you're washing loads and loads of laundry all night long. That all of these things don't need to be done all night long, and normal people sleep during the night unless they're students who are pulling all-nighters for school. But we have to really ask the right questions and observe the behaviors to identify whether this is a variation of a normal state or what's called a pathological state or an abnormal state that's not healthy. And, again, with celebrities who are getting diagnosed with bipolar 2 disorder, that's wonderful, and they're probably accessing the top doctors, the top psychiatrists, the top psychologists in their communities and getting great care. And for the rest of us ordinary human beings, we need to really have our loved ones around us be vigilant, and if we can, be vigilant within ourselves about the kinds of behaviors that we're getting into. But unfortunately, when we're in the throes of a hypomanic or a manic episode, insight is the first thing to go. And so it's most likely that we're not going to notice ourselves that we're having difficulties, and everyone around us is going to have to notice. So for those of you who are noticing a loved one, a friend or a family member starting to exhibit certain kinds of behaviors, such as not sleeping for several nights in a row, talking super fast, getting involved in a lot of activities that might be considered self-destructive, being hypersexual, either extremely irritable or euphoric or paranoid, spending an enormous amount of money in a short period of time on things that they might not necessarily need, being extremely impulsive, possibly feeling grandiose and super important and like they're going to be the next Prime Minister of Canada or have a million YouTube followers all of a sudden, things that are not likely to happen, then we need to have that little red flag waving and go, uh-oh, maybe this person needs to see a mental health practitioner. So it's wonderful for Selena Gomez and all the other Hollywood celebrities and athletes and people who are very wealthy and famous and connected, because they're going to access great care. So the rest of us need to help our loved ones by paying attention and noticing the subtle signs, especially of bipolar 2 disorder, and helping our loved one get the care that they need so that they too can be well and carry on with their life in a more positive way. I'm Dr. Marcia Sirota, talking about how it's really important for all of us to get the care that we need when we have any kind of mental health condition, and how it's great for celebrities to bring attention to the condition, and now the friends and families and loved ones of people need to pay attention to the signs so that they know what to look for in case one of their loved ones becomes ill and is exhibiting signs of a major mental illness. Stay tuned for more topics on wellness and mental health. I'll see you soon.